Topping today's health alert, it's the 9th of the month. Have you called your buddy today? There's a new cancer advancement that improves the treatment of breast cancer for patients who need radiation therapy. It's a 3D surgical marker that allows for better results with less risks to healthy nearby tissue. Janice Monk is a veteran federal attorney for the U.S. Coast Guard, and she's a breast cancer survivor. The diagnosis was confirmed in January after a routine screening mammogram detected a lump.
Luckily, I was diagnosed at the stage 0 level, and it's called DCIS, or ductal carcinoma in situ.
Doctors recommended a lumpectomy to remove the cancer and whole breast radiation to prevent a recurrence. Two types of radiation she considered were intraoperative radiation therapy, done at the time of the surgery, or a catheter-based therapy, brachytherapy, which lasts only a week.
Unfortunately, it was determined that I was not a good candidate for either of these two therapies because my malignancy had spread a little more than was originally thought.
Good morning. But there was a third alternative. Concerned that radiation often results in damage to healthy nearby tissue, Janice opted for an innovative approach using BioZorb.
By the time the patient is able to undergo radiation, they have to have healed. And so the healing process can sometimes then make it difficult to know exactly where that location was. When we use BioZorb, we're able to put in something that is impossible to miss.
In Janice's case, a 2 by 3 centimeters long BioZorb coil was inserted where the tumor had been removed and then sutured in place. The coil holds 6 titanium clips arranged in a 3D pattern. BioZorb dissolves in about a year, but leaves behind the clips at the treatment site to serve as a visual cue for future radiation treatments and her follow-ups. BioZorb also helps the cosmetic outcome.
I'm feeling great now. I have all the optimism in the world about the future.
BioZorb is appropriate for anyone who is not a candidate for partial breast radiation. BioZorb is also FDA approved.